Welcome to all medias. Today we are going to discuss about the most important aspect of cardiovascular examination. As you know, that is how can we auscultate the cardiac areas with the help of a stethoscope. Regarding the part of stethoscope, the chest piece, in that chest piece the border or the larger area, that is what we call the diaphragm, is commonly used to hear the cardiac sounds or the heart sounds, and the earpiece, it is to be directed anteriorly to hear the heart sound in a very clean manner, because the direction of external to middle or internal ear is directed anteriorly. So while placing the earpiece of your stethoscope, keep in mind the direction of earpiece should always be in anteriorly to your ear. Next, let us see how to proceed to check the cardiac areas. First of all, let us know the main four cardiac areas. As you know, they are the mitral area, number 2 tricuspid area, aortic area, and pulmonary area. Mitral area is usually nothing but the area of apical impulse. It is the most visible, most powerful area of impulse by which we can auscultate the same in a very nice manner. The location of apical impulse is at, usually in a normal person, left fifth intercostal space, half an inch medial to the mid-clavicular line. That is the mitral area. Next, we have to locate the tricuspid area. It is usually the left to the fifth intercostal space. There is the tricuspid area. Regarding the aortic area, it is over the second right intercostal space, just right to the sternum. Like that, the pulmonary area, that is over the second left intercostal space, just left to the left border of the sternum. That means in a person, the left to the sternal side cover the mitral and pulmonary area, and right second intercostal space at the aortic area, and left fifth intercostal space just lateral to the sternum, that is the tricuspid area. Regarding the heart sound, as you know, the first heart sound is because of the closure of the mitral and tricuspid valve. Likewise, the closure of the aortic and pulmonary valve is the second heart sound. The first heart sound is otherwise known as S1 and second heart sound S2. S1 usually corresponds to starting of systole of heart, and S2 usually corresponds to starting of diastole. S1 corresponds to carotid pulsation, that means there is no split, but S2 usually corresponds after the carotid pulsation. So that while hearing the S1 there is no split, and S2 there is split, especially during inspiration. Similarly, the S1 usually corresponds to R wave of ECG, and S2 corresponds to T wave of ECG. While auscultating the heart, first heart sound is heard as sound like that, lub, and the second heart sound is noted as dub. So the lub sound is the first heart sound, and dub, that is the second heart sound. To auscultate this area, first of all we have to confirm the position of the apex, that is already mentioned in our earlier classes. While auscultating, you have to note the heart sounds, its character, intensity, expansion, rhythmicity, presence of any abnormal sounds, etc. has to be dealt with auscultation. Let us study about the first heart sound. In first heart sound, there may be some abnormality can be seen in physiological situation like anxiety, nervousness, or feverish conditions. in pathological conditions like mitral stenosis, thyrotoxicosis, and in anemia also give some abnormality in first heart sound. While auscultating the mitral area, it is soft in conditions like rheumatic carditis, valvulitis, left ventricular dysfunction, calcification, obesity, and emphysema. While observing the second heart sound, there may be some abnormality can be seen in physiological conditions, usually in older people. Pathologically, abnormal second heart sound may observed in systemic hypertension, mitral stenosis, thyrotoxicosis, and in anemia. The second heart sound also may be very soft in aortic stenosis or calcified aortic valves. On auscultating the pulmonary area, the pulmonary sound or the P2 may be very loud, especially in younger people, a physiological status. But in patient with portal hypertension, the second heart sound may be very loud, and the soft P2 or soft pulmonary sound may observed in calcification of the valves. So, by using the diaphragm of your stent, you can hear the first heart sound at the apex of the heart, by which you can hear a lub sound, especially in mitral and tricuspid area. Regarding the frequency or the pitch of the first sound is, it is long, dull, and a booming character with a low pitched sound. While the second heart sound or the S2, and while hearing the second heart sound, there is a split between the aortic and pulmonary valve, especially during inspiration. If the S1 is long, dull, and low pitched one, the S2 or the second heart sound is very short, sharp, and slapping also with high pitched sound. So S2 sound is somewhat high pitched and heard as dub, and the first heart sound is low pitched and heard as lub. By using the bell of stethoscope, by that we can hear some murmurs. As you know, the murmurs are nothing but the sounds produced due to turbulence of blood flow through an abnormal valve, or abnormal amount of blood through a normal valve, or abnormal amount of blood through abnormal valve. That means while flowing of blood through an abnormal opening, usually either in stenosis or in regurgitation, that may produce some turbulency. And the features of the murmurs are varying regarding its time, whether it is systolic or diastolic, depending on the pitch, frequency of sound, low pitched or high pitched, about the quality, intensity, location, radiation, etc. are varied with the area of involvement. So the same set of murmurs can be well heard with the bell of your stethoscope. At the apex, especially in early phase of diastole, a low pitched murmur can be heard in mitral regurgitation, aortic regurgitation, and pericarditis. Otherwise, it is known as the third heart sound or the S3. It is due to rapid ventricular filling. In late diastole, with the same bell of your stethoscope, the fourth heart sound may be heard and is usually pathological, and it is due to forced atrial contraction. So, with the chest piece, with the diaphragm, you can auscultate the mitral, tricuspid, pulmonary, and aortic area. You can understand the quality, nature, normality, or abnormality, murmurs, etc. By that, you can come into a conclusion of whether your patient is having any cardiac anomalies or cardiac pathology, and whenever it is necessary, you can proceed to do the other invasive or non-invasive investigations of cardiovascular system, say echocardiogram, treadmill test or angiogram or nuclear scanning, etc. That's all about the basic cardiovascular examination with inspection, palpation, percussion and auscultation. Thank you for patient hearing. Thank you.